Hi everyone, this is Allie from Grief and Grace, and today I am talking about week 14. So I had my anatomy scan, my second anatomy scan. It was a follow-up from the first visit because they couldn't quite see everything the first time. So the technician and the doctor wanted me to come back just to make sure that they could check everything out. And it looks like everything's great. Baby's doing really well. Baby was still moving and grooving. So that was funny to see, and it was so cute. I got to see baby yawning, and I got more pictures, of course, which was really nice. So that was good. I'm not sure if I'll do any more anatomy scan or any more scans, ultrasounds. The rest of the pregnancy, we'll probably see maybe if there's any concern for baby being breech. Careful, honey. Okay. If there's concern of baby being breech, maybe, but other than that, I'm probably not gonna do any more ultrasounds, but we'll see what happens. But it was nice to go to see the baby again and just to, just be reassured that everything is going well and everything's looking okay. So baby's doing well. I am still having some round ligament pain, maybe pelvic girdle pain. I forgot there's another medical term that my chiropractor used for it, but I'll look it up and I'll link it below. But that has been kind of hard. I know I mentioned last video that there was one day where I was just in tears because it hurt so bad. I couldn't even walk without being in pain. And so it hasn't been that bad, but it has been kind of mild. And I would just say it gets exacerbated if I'm doing a lot more lifting, if my kids are a lot more needy that day, or if I'm doing a lot more walking, if we're out and about and walking around. Are you stuck, Jacob? Let me get my son. He's being a wild man. So also if I'm doing, okay, I need you to get down now. Also, if I'm doing a lot more cleaning or just on my feet, I'm noticing that the pain is definitely exacerbated. So I'm trying to do things like specific stretches and exercises that are targeting that area a little bit more to help. Definitely doing the Webster technique with my chiropractor has been helping. And when I'm laying down, I'm trying to have a pillow in between my legs. I know my chiropractor mentioned, pretend you're wearing a skirt and you need to keep your legs together when you're getting in and out of the car, which I'm not remembering all the time, so I do need to be better about that. But, sometimes things just kind of, you're trying to take care of yourself and do the best you can, but especially when you're running around busy, and if you do have other, living children that you're chasing after, especially these two toddlers that keep me busy, it's just a little hard to remember to prioritize those things so that I can try to mitigate the pain. But that has been the main thing, is still going to my chiropractor. I'm really trying to see her every other week. I did have a follow-up appointment with my OB. Excuse me as I wrestle my child. Hold on, Jacob. I'm almost done, okay? I did have a follow-up appointment with my OB. And something that I was going to mention is, trying to remember that sometimes the medical field, those in the medical field that you're working with, don't always have a Christian perspective. And I'm really trying to give grace to that, and just to remember that they're not always going to say the right things or say things that are sensitive and make you feel better about the situation. For example, my OB was mentioning how this is my second pregnancy, even though he knows I've had miscarriages. And especially one I was treated, by him, or at least saw him after my hospital visit. So it is frustrating and kind of hurtful when he says that, refers to this pregnancy as my second pregnancy, when it's not my second pregnancy. It's technically my fourth pregnancy. But just giving grace to the medical field, because they're not always going to be the most sensitive, and they might not have a Christian perspective on things. And just remembering that how we view things, it might be different. I've been super emotional. I'm just looking at my notes. Super emotional and a little irrational and overreacting to situations. There've just been a few things that happened the last few weeks where I felt like I wasn't really being myself. I was having very high emotions and just not acting maybe at my baseline. And so that was kind of tricky. I did bring it up with my therapist because I am still seeing a Christian counselor. And, you know, she's just reminding me that our brains, you know, certain areas are going to kind of shrink in pregnancy and in the postpartum period, like our reasoning and logic and things like that, because our empathy skills are growing and you're making room so that you can respond to your child and your baby. So just trying to give myself grace too, but remember that like I do need to have strategies to walk away and try not to overreact to the situation, and just remember that I'm in a very I am wrestling my son right now. Just remember that pregnancy is kind of changing my emotions and my hormones are kind of all over the place. So just remembering all of that. My allergies have been horrific. Itchy eyes, constantly sneezing. I'm even having like a little allergy, like reaction rash. So just lots of stuff. I'm just chalking it up to pregnancy and just dealing with all that and the hormones. I'm just looking at my notes. So something that was nice is now that it's September, our small groups through church are starting again. So I did host a Bible study for a small group at my church this past weekend, which was really nice. And then last night, the moms group that I attend, it's every other Wednesday night, that started up again. So that was just really nice and really fills my cup. It's something that I really try to do for myself, to meet and gather with other Christian women and other Christian moms too. And it just helps to, you know, just have people who are in your corner and just with similar worldview, and just having Christians in your life is just so needed and so necessary. And I've been very, very blessed with that. It's something that I really prayed for. All right, I think that's it for the updates. My son needs me right now. I just want to end with the song of the week. Okay, I'm almost done. I just want to end with the song of the week. It's Fill My Cup by Andrew Ripp. And then the verse of the week I'm going to read is from Hebrews chapter 4, verses 15 through 16. For we do not have a high priest who is unable to sympathize with our weaknesses, but one who has been tempted in every way as we are, yet without sin. Therefore, let us approach the throne of grace with boldness, so that we may receive mercy and find grace to help us in time of need. All right, I hope that you're all doing well, and I will chat with you next week. Bye.